Thank you very much, Claudia. Thank you, Brian, for this wonderful idea to share those experiences in integrative medicine models. We are a bit smaller than New York and Essen-Mitte, a bit younger. St. Gallen, for Swiss dimension, is actually really a bigger hospital with 5,500, more than 5,500 employees, and is a very active active hospitals with a high impact, especially in oncology in Switzerland. Integrative medicine in St. Gallen was driven by physicians. So it was no pressure from outside, it was just the will in oncology, in palliative care, of a couple of physicians discussing if it would make sense to start an integration of complementary medicine. And we were allowed at that time, 2009, to start with a pilot project for integrative medicine in palliative care. This was a very interesting project from May to December 2009, and we could say after this project, thus introduction of complementary medicine in a palliative care unit was feasible, and there were no major safety concerns. No more, but no less. So we could go on with this project for integrative medicine, and on the 4th of October 2012, we had the inauguration symposium of the Center for Integrative Medicine. So we are young. But before we could start, you can imagine in an academic setting, there were many, many discussions with a lot of heads of different departments and clinics. And here you can see the different discussions we had with the heads of the pain center, the radio-oncology, the palliative care center, oncology, breast center, psychosomatic nursing department, very important, rheumatology, general internal medicine, urology, etc. So there were many discussions, critical discussions, but we found a consensus so that we could start with a name and with a location of the department. And this is what we how we treat, what we have in the integrative medicine in St. Gallen. As a whole medical system, we have anthroposophic medicine with drugs, nursing intervention, external applications, arts therapy, therapeutic eurythmy, a movement therapy, Chinese medicine with acupuncture, tuina, and more herbs. This comes actually from the anesthesiologists who practiced before. Osteopathy was at the hospital before 2007 already. At mind-body medicine, we have only the mindfulness-based stress reduction and the very important part of safety and counseling. A very challenging part, in my opinion, safety. The question of reimbursement. We treat outpatient and also inpatient, outpatient. Everything in Switzerland, what physicians and nurses do, are reimbursed by the basic health insurance. Complementary therapists like osteopathy, art therapy, therapeutic eurythmy, patient must have a complementary insurance, and this means 60 to 70% of patients in Switzerland. For the inpatients, we can partially reimburse what we are doing with the disease-related group system. You know, there are the complex therapies, palliative care, pain, and also now complementary medicine complex therapies. And there I can put my therapist in those packages to help the colleagues to finance this inpatients. So this is interesting in a model if you want to integrate in a conventional hospital. So we have the groups, mindfulness-based stress reduction, also to have an acceptance of an MBSR program, which is very well known in the US, and Gustav Dobos has very propagated this in a nice way, but it was really not known in St. Gallen. So I started a group with chiefs of the different clinics and departments, also nurses and physios, and we do together MBSR groups and had a very good experience. We evaluated this, and so it was easier to implement that. External applications like rhythmic functions, like cataplasm, oil compresses, etc. Nursing, very important for the inpatients. Movement therapy like eurythmic therapy, art therapy. We were asked, Arno Templeton and myself, as oncologists working like regular oncologists, to write a paper for general practitioners. What should they know? And we tried to do that with our experience, with the evidence we knew, made a table. And here you can see, we don't have to look at all those points, but what is possible as an indication, what are possible therapies like acupuncture, nausea, emesis, we saw this before, massage, in mind body techniques like arts therapy, mindfulness-based interventions, yoga with sleep disturbances, etc. At the center, we are working with outpatients. 70 to 80% of our patients are outpatients. 20 to 30% are inpatients. So we have a higher activity on the different wards in the Cantonal hospital. When at the end of the year we were thinking to write the Christmas cards to the wards we were going and working at, we just were thinking to whom we have to send it, and we realized we really have to send it everywhere. Surgery, cardiac, everywhere, cardiology, etc. Everywhere we had to send it. We were at different points, but we are at some points more often. For the in and out patients, we have a step concept. Step A is there is no fixed integrative medicine. So everything is on demand. Physicians go to the ward, therapists and the nurse as well. We have MIN, this means mobile integrative nurses. So they have a Samsonite with their material and they go up to the wards and do the cataplasm or the rhythmic unction, etc. Step B, if you have the ward trained, the nurses are trained in external applications and also with the integrative medicine drugs we use. On demand are physicians and therapies, and step C is when the physician on charge on the ward is trained as a conventional physician and a complementary physician. Step B is implemented at the palliative care and chronic pain ward, at the acute oncology ward, the breast center, outpatient based, and in the children's hospital in the Center for Pediatric Hematology and Oncology, and there are other which are planned. But you must go very carefully because you have to train those people. You have to check if you can let them work with patient, and you have to make refreshers to visit them again. So it's a lot of work just to maintain a quality on the wards. How many people are we? We are 17 persons. We will be next year 19 because the center is growing. We have more and more referrals. And I think this is also an important thing. We don't take patients just coming to our center. They must be referred by physicians. So it's only referred. Here you can see the people working there. For example, Stefan Hegele, who is here, is a neurologist, a consultant in neurology, but also trained in complementary medicine. I am an oncologist doing regular oncology. Then general internal medicine practitioners. There are two of us, an anesthesiologist who makes the TCM, Chinese medicine and acupuncture, and therapists, nurses. The secretary are laughing, but they have a lot of work with us. This is a wonderful team. This is very interesting, but this is really a challenge because, and I call it the interdisciplinary and multi-professional challenge, because you have to make the integration not only conventional complementary, but also complementary at our place. We have physicians who are trained in oncology, neurology, general internal medicine or anesthesiology, plus anthroposophic medicine or Chinese medicine. We have therapists, osteopaths, art therapists, movement therapists, we have nurses. And to have really a good exchange and to have a discussion about the patient to have a good quality, we meet weekly between physicians and all the therapy groups. So on Monday, the osteopaths, on Friday, art therapy, on Wednesday, eurythmy, nurses on Friday, etc. So we meet half an hour and discuss all the patients we have. And we have one integrative board, is the I board, so it's not a virtual board, but it's we are sitting on a table and discussing all the new patients of the week and the difficult patient. And we have in the hospital other boards and other meetings, for example, a pain board, and there we are involved. There's, in each of those meetings and boards is an integrative medicine physician or a therapist. So pain board, rheumatology board, oncology meetings, pediatric oncology meeting at the Children's Hospital, a pain meeting in Flavi. This is a hospital which belongs to the Cantonal Hospital in St. Gallen, and also the palliative care ward meeting. So this is really for the integration. We have to integrate integrative medicine. It's important. So if you look at the numbers, we have on outpatient basis 4,500 visits, and inpatient 2,196, a total of 6,759. This was 2014, and this is growing. Since 2009, we organize a symposium, Integrative Oncology and Research, together with the University of Bern and Witten-Herdecke in Germany. And here you see project groups. This is the aim, that we can have project groups who initiate research and do the studies. And this year we will have the integrative pediatric oncology. So this will be the first time that there will be a group for integrative pediatric oncology in Switzerland. As the example of integration in oncology, this was published in the Swiss Cancer Bulletin of this year. And here you can see the Organization for Research in Oncology, Department of Oncology here in the middle. And there is a good network with the Palliative Care Center, the Breast Center, and also the Center for Integrative Medicine. So also there must be a good integration. I come to the end of the presentation. If I ask why an integrative medicine, I think an integrative medicine gives for your patient a chance for complementary perspective with therapeutic consequences. You have new supportive possibilities, and we could see this in the focus groups we did in this pilot project. Really new supportive possibilities, new views, complementary, an individual empowerment of the patient, and you deliver healing creativity also within your own life. And now I finish, and I thank you for your time.